Today's event is sponsored by Congressman Paul Tonko and Dave Joyce, co-chairs of the House Addiction Treatment and Recovery Caucus. We're excited to have such a great lineup of speakers speaking to you today about the importance of ensuring high-quality care is available for substance use disorders within corrections and how the Reentry Act will help. Unfortunately, Senator Baldwin was unable to make it today due to an unexpected scheduling conflict. However, she asked us to share her apologies with you and her appreciation for all the advocates working on the Reentry Act. So I have just a few quick housekeeping announcements before we get started. First of all, the session is being recorded and we have a lot to cover in just 30 minutes. So we ask that you keep your microphones muted to try to help us avoid interruptions. If you have questions, please drop them into the chat. Unfortunately, because we have such a short amount of time, we won't be able to answer questions during the event, but we will collect all of the questions and respond to everyone as we can. So with that, we're going to dive right into our first speaker, Congressman Paul Tonko. Congressman Tonko is an 8-term member of the U.S. House of Representatives, representing New York's 20th Congressional District. He is the co-chair of the Addiction Treatment and Recovery Caucus, and successfully led bipartisan efforts in the last Congress to pass the Mainstreaming Addiction Treatment Act. And now he's helping to lead the charge on the Reentry Act. Congressman Tonko, thank you so much for your leadership on this, and the floor is yours.
Thank you. Libby, can you hear me? You can?
Yep.
Okay, great. Thank you, Libby, and thank you everyone who's participating here. It's great to have your voices heard so that we can best engage in this issue. It's my honor to welcome all of you to this virtual briefing for the Addiction Treatment and Recovery Caucus. As many of you know, the ATR Caucus has a history of strong bipartisan support, and I'm indeed proud to serve in the caucus leadership as co-chair, along with my colleague and friend, Congressman Dave Joyce, and we're determined to have a number of success stories with legislation as we work through the caucus. During today's briefing, put on in collaboration with the caucus and the Overdose Prevention Initiative, and thank you, Libby, we will hear about the barriers in place that prevent incarcerated individuals from having warm hands-off that lead to treatment and recovery and good transitions in care. This is especially significant for those struggling with addiction. As many of you know, I have long recognized that addiction is a disease, and this disease of despair deserves, beyond belief, a response rooted in hope. For many in our community, the people on this call provide that hope. And for those new to this area, we welcome you to join in providing hope. I strongly believe that we must broaden our focus from arrests and incarceration alone to include pillars of prevention, of treatment, and of recovery. We must invest in treatment and recovery services and help prevent future loss of life. We need smart policies that allow us for certain to achieve access to treatment. I spent many years working to pass the MAD Act and am proud of that success. Another effort I find equally, if not more critical, is our Reentry Act. I place such significance on moving this bill forward because it has the potential to connect people with care and save lives at a dangerous time in their lives. Due to reduced tolerance for opioids and a lack of effective treatment options in prisons and jails across our country, individuals returning home from incarceration face an exponentially greater risk of overdose. In fact, studies show that former inmates are 129 times more likely to die of a drug overdose in the first 2 weeks after their release than the general population. And so we can rightfully say that our friends deserve better. With this alarming data in mind, I teamed up with a bipartisan group of legislators to introduce the Reentry Act, a bill that empowers states to restore access to Medicaid benefits for incarcerated individuals up to 30 days prior to their release. By allowing inmates to receive addiction treatment and other services before returning home, this legislation will bring targeted treatment to those at the highest risk of overdose. Supported by more than 100 organizations, from law enforcement to addiction advocates and public health and religious groups, the consensus is clear that this bill will save lives, lower medical costs, and reduce recidivism. For those of you who are already supporting the Reentry Act, a hearty thank you. And for those of you who are considering supporting, I hope the speakers today help speak to why this is so critical and that will engage your support. With the reauthorization of the Support Act coming up, we also have an opportunity to move this forward. In 2018, a demonstration program that allowed for reentry was passed as part of the Support Act. This reauthorization is a chance to codify this so that reentry will apply across our country. We have a short window of time to build support and make a difference at a critical point. I welcome our speakers today and urge all of us to listen, to discuss together and plan so we can take action to address this crisis. And with that, I turn the floor over to a constituent and friend, our Capital Region of New York's very own Dr. Colleen Parent, with New Choices Recovery Center in Schenectady, New York. And they serve hundreds, perhaps 700 to 800 individuals. They're a quality team. They are devoted. They're passionate about making a difference. And I'm honored to be their voice in Washington. Dr. Colleen Parent, the floor, the video, the Zoom is yours.
Hello, everybody. Thank you. I've been working in addiction medicine now for almost a year and a half. I'm a primary care family medicine doctor by training, and I got a little bit burnt out from that and realized that the favorite thing that I got to do in my day was see my folks with substance use disorder and see their lives change for the better and feel like I got to be a part of that. So I decided that's what I wanted to do all the time. So I have the great pleasure of working at New Choices, where we get to see a variety of folks with a variety of substance use disorders. And I'm honored to be here today to talk about this very important issue. We see a lot of folks who had been recently incarcerated, either in jail, in prison, and they are at the greatest risk right when they get out. And I don't know if you guys have tried to make new doctor's appointments for yourself or get a primary care doctor, or do that with resources like knowing who to call and having a place to live and having a phone and having money. It's still quite difficult. So imagine that as someone coming out who may have been incarcerated for a number of years without resources, without knowing how to manage, how to get insurance, how to do any of these things, because it's a very complicated system. And I'm in healthcare and I find it complicated and I know how it works. So it's almost impossible to navigate that system. So by allowing people to have this set up before they get released, they're able to have follow-up scheduled, they're able to get into treatment programs and have that lined up before they're out, and be able to have a prescription for Suboxone or get hooked up to an OTP and receive methadone medication. All of that will save countless lives and money, which is good. People care about that, but lives are more important to me. And it'll allow folks to be able to get the treatment they need, both in terms of their substance use, but also all their other healthcare needs, which are vast and important. And one of the things about buprenorphine or Suboxone, there's still a lot of ideas about it, but one of the things that's amazing is that the number needed to treat in order to prevent one overdose death with Suboxone is just 11 people. If we had other medications like that, we would be screaming and shouting it from the rooftops of this is the best medicine we have on the planet. So for just a comparison, aspirin, we all know about aspirin and heart disease and how everyone should take aspirin to prevent their heart attack. The number needed to treat to prevent one heart attack with aspirin is 333 people. So everyone on the planet's on aspirin, and it still takes 1 million people to treat, but we only need to treat 11 people to save one life, which is really amazing with Suboxone. So we need to allow the people who critically need the access to the medication, get that medication when it's most important, because their lives matter. They're someone's son and daughter and mom and dad and sister and brother, and these folks deserve to be treated well with compassion and respect. They've served their time, they're out. Let's keep them healthy and safe so they can return to their families and return to their world. So again, I really appreciate you having me here today. I hope that this is something that everybody can get behind, because who doesn't want to help people live and live well?
Thank you so much, both to Congressman Tonko and to Dr. Parent. Our next speaker is Dane County Sheriff Calvin Barrett. Originally from the San Diego area, Sheriff Barrett came to Madison in 2000 to attend the University of Wisconsin and to play football for the Wisconsin Badgers. After graduating, Sheriff Barrett then moved to Texas before returning in 2009 to Dane County to begin his career as a peace officer. Sheriff Barrett has served as the 53rd Dane County Sheriff since 2021. So Sheriff Barrett, over to you.
Thank you all for being here, and thank you for the opportunity to share the importance of this Reentry Act is to our vision, mission, and philosophy of reducing recidivism and overall saving lives with those that are incarcerated. It is so important that this policy moving forward, it helps us with the new type of vision and philosophy for sheriffs across the nation, which now focuses on corrections and not simple punishment. Over the past 5 decades, we focused so much on punishment, meaning we thought if we created a jail and a punishment that was severe enough, it would change future behavior. We've seen, and the numbers and the data have shown, that it does not work. We've incarcerated nearly 2 million people, and we still see the same things happening over and over, and the violence, the cycles of violence continue. We have to focus on corrections, and there's a big difference between corrections and punishment. Our goals in corrections is to change future behavior through education and through resources to prevent future crimes from happening. This is not only important for the individual that's receiving the treatment, but this is important for their children and future generations as well. As we've seen through different causations and theories of crime, the social learning theory, the strain theory, and the conflict theory that continues the cycles of violence that continue to incarcerate those across our country. This bill continues to focus on the proactive efforts of getting upstream with the issues that we're seeing that lead to incarceration and moves us away from that draconian and reactionary response of simple punishment. Us as sheriffs, we have to continue to have the resources to be successful. We have to have the facilities. We have to have the funding to be able to put those resources in place so that there is a warm reentry from our incarcerated population back into the community. We have to have those resources for our medication assistant treatment programs, our Vivitrol programs, and many of the other programs that we have at our Dane County Sheriff's Office to help reduce recidivism and save lives. This bill, this Reentry Act, is imperative to all of the sheriffs across the country, jails and prisons, to ensure that we're continuing to reduce recidivism and save lives. At the end of the day, 97% of those who are incarcerated right now throughout our country are going to be released back into the community. They're going to be our neighbors, our brother-in-laws, our sister-in-laws, our employees, and our friends. And we have to make sure that they are built up and better when they're released to the community and not bitter and broken. And that's what this act allows us to do, as it complements all of the additional work that's needed to ensure that we reduce recidivism and save lives. It is a true honor to be here. And if anyone would like to speak and learn more about the things we're doing at the Dane County Sheriff's Office to help with these proactive measures, I am more than willing to speak offline to ensure that what we're doing here is being shared, but also we are anxious to learn what's going on across the country to help those that are in Dane County, Wisconsin. Thank you again for this opportunity, and thank you to all of the elected officials for their leadership in this very important topic.
Thank you so much, Sheriff Barrett. Our next speakers are Maurice Neenan and Dr. Montavani Gay from the Chesterfield County Jail in Virginia. Maurice is a 52-year-old loving father from Falls Church, Virginia. He's a certified drafter who worked on projects that include the Michigan State Capitol, the Moultrie Courthouse, and a child development center at Fort Meade. Maurice is a peer recovery specialist and is certified in the trauma tapping technique through the Peaceful Heart Network. Maurice is currently a mentor for helping addicts recover progressively, or the HARP program, at Chesterfield County Jail. Maurice has a passion for advocating for those who suffer from substance use disorder, and recently worked with Senator Mark Warner of Virginia to advocate for the passage of the No Pain Act, which allows non-opioid options for management of pain in healthcare settings. Dr. Gay is the medical director of the Chesterfield County Sheriff's Office, a position that he's held for the past 19 years. Dr. Gay graduated from the University of Florida College of Medicine and completed his internship, residency, and fellowship at the Medical College of Georgia. In 2016, Dr. Gay helped Sheriff Carl Leonard start the HEART program, which has since garnered local, national, and even international attention. The program has also helped more than 2,500 men and women participate in the recovery process. Maurice and Dr. Gay, thank you so much for being here, and the floor is yours.
Thank you very much. Thank you very much for having us both. This is an honor. I was conflicted on how to begin and where to start. So let me start with how I ended up in here quickly. I was robbed and beat with a sledgehammer in my driveway, created multiple facial fractures, breaks, and I was placed on opioids. I'm an addict. I was asked at the hospital if I had any known allergies, and I let them know immediately that I suffered from substance use disorder. But I was still given fentanyl and oxycodone to manage the pain. When that medicine ran out, I resorted back to what I had known in the past and shoplifted to provide the medicine that I was needing or thought that I needed. I'm fortunate to get locked up in Chesterfield County, and they had the HEART program. As you said, I'm 52 years old, but at 50 years old, I had not tried anything. I'd just been told not to use, and I would be okay, just don't pick up. I learned through the HEART program that I suffer from substance use disorder, and what that really entails is not just the drug addiction, it's behavior and thinking patterns as well. So I've addressed those. I was here for a number of months before I made bond, and through a grant that Dr. Gay had wrote, I was afforded the Vivitrol shot prior to release on bond. And when I got out, I had no cravings. I went back to work. They helped me transition with mental health and counseling, and I ended up going to court, getting my time, and I'm back, but not with the new charge. I bring that up because HARP is doing something unique here, and they're struggling financially to get what they know we need. We have a reentry coordinator who daily is working to help us get into sober living houses, getting Medicaid, signed up for Medicaid prior to release, but not starting till release. And that's been a problem because, as Dr. Parent said, we forget sometimes that life happens, and it's not just going out and taking care of the medication that I need for this disorder or my mental health counseling, but it's looking for a job, it's getting, lit housing, it's food, it's everything that life entails. And so if I have Medicaid prior to release, then that's one thing that I don't have to concern myself with. I can move on and focus on other things. I can have appointments set up already, the same week I'm out, rather than applying for Medicaid or finding a primary care physician and getting these taken care of once I'm released. I think it's enormous what this would do for us. Like I said, HARP has found ways to get through and help us through this. And because of that, our recidivism rate through HARP is 11%. The recidivism in the Virginia Department of Corrections that doesn't have the HARP program is currently 24%. So it shows that it works. And the reentry as a whole, I suffer from substance use disorder, but I also have hepatitis C. And so getting this Medicaid prior to release would help me start that process rather than trying to find a doctor upon release to take care of that as well. That's what I've got. Thank you.
You're welcome. As our previous speakers have spoken, here at the jail, we do all forms of MAT. We do Vivitrol, buprenorphine, and methadone. We started back in 2016, like was mentioned earlier, with Vivitrol. Then we moved to buprenorphine, and now we are also doing methadone. However, we can do everything here in the jail. The real action is when they get released, because here they get someplace to sleep, they get medications, they get medical care, but when they get out, they don't have a job, they don't have a car, they don't have a driver's license. And there are lots of different barriers that will cause them to either go out and seek more drugs because that's what they know, or they do something and then they come back. So with this act, this will help immensely because we do have 2 grants that have funds, but as everybody knows, grants tend to can run its course and run out. So that's always a concern of mine, that we won't have the money. But right from the beginning, we have a reentry plan for everybody. They get treated here, and before they go, they can get their peer certification here. They get the training, but they also can take the test here, which was a novelty for this jail. We were the first jail to do that in the state, in Commonwealth of Virginia. We have a clothing closet. We're able to get them housing and sober living places. So we even started a program where those individuals that are not in for any length of period of time, if they're here for a short time, we have some peer navigators that allows them to get those rapid releasers resources so that when they go out, they don't overdose. Because once you're off of the opiates for about 3 days, your tolerance starts to go down. And there are a lot of people that come in, they're only here for 24, 48 hours. So we're releasing people back out that are now their tolerance is down. If they don't have any resources, they're going straight to get something and may die. So this act is very helpful in us getting the funding and get people their reentry services that are needed. Thank you.
Thank you.
Thank you so much. Thank you to all of our speakers and everyone who joined us today. As I think our speakers made very clear, the urgency and the need for the Reentry Act is very clear. Please continue to your advocacy efforts and your outreach to Congress, particularly to the House Energy and Commerce Committee, so that we can make sure that the Reentry Act is a high priority in the 118th Congress. That concludes our programming today. We are right on time. Thank you so much for attending. And if you have any questions, please send them in through the chat and we will try to connect you with folks who can respond. Thank you so much. Have a great day.
Thank you, Libby.
Thank you, Congressman. It was a true honor to speak here with you. Thank you for the opportunity.
Thank you. And just the information you all shared is so important. We don't tell the stories, the struggles enough. And so thank you for your courage and your boldness to share the stories, and let's make this happen.
Absolutely.
These lives are worth saving, so let's make it happen.
Absolutely. Thank you, sir.
Okay.
Have a good day, everyone.